I'd like to talk to you about this medication called Duloxetine. Another name for it is Cymbalta. It's again effective for anxiety and depression and many mental health symptoms that come with that. But also, what's unique about this medication is it can help with several medical conditions. It can help with neuropathy, or which is like pain in the nerves, like usually in the hands or feet. That can occur in diabetes and alcoholics. So it can help with that type of nerve pain. It can also help with fibromyalgia, and it can help with muscle pain in general. So it's not only does it work on serotonin, like a lot of the other antidepressants and anti-anxiety medications, but also works on this molecule called norepinephrine. And it's thought that that norepinephrine effect is what helps to bring pain relief. So just like the other antidepressants and anti-anxiety medications, this medication can be very sensitive on the stomach, so it can be taken with foods initially for one's body to get used to it, and just to be watch out for some side effects like nausea, constipation, diarrhea, the upset stomach side effects. With these types of medications, some people have reported fatigue or problem sleeping, and so it can affect the sleep and the energy levels a bit. The dosing on this medication can be as low as 20 milligrams and as high as 120 milligrams. And so typically it's a good rule of thumb to start at a small dose and work your way up to minimize any chances of side effects and to have the medication effective at the lowest optimal dose to minimize those chances of side effect. So just like some of the other antidepressants, this medication can lead to a serotonin syndrome, which is a rare but concerning condition in which someone may get muscle cramps, feeling hot, flushing, diarrhea, maybe they get shaking or confused. And in these cases, all their psychiatric medications typically need to be stopped. They need to be rehydrated well, sometimes even hospitalized to get IV fluids. Just like all antidepressants or anti-anxiety medications that work on the brain and spinal cord, there's a lot of potential side effects with this medication, maybe worsening mood, worsening anxiety, suicidality. So it should be used cautiously. Also be aware of all your thoughts and feelings that one has when starting a new medication or making changes to see if the medication is contributing to that. People with bipolar disorder can have an adverse reaction where it leads to more manic or hypomanic symptoms. Probably this medication should not be taken in those cases.